Hello, I hope you are starting to feel the festivities. For those of you who celebrated Hanukkah, I hope you had a good week. And then, of course, for those who are participating in Christmas and Kwanzaa, I know that we are in countdown mode. So I hope it isn't causing too much stress and you're able to enjoy the seasons. So we knew this was going to happen, right? We've got a new variant. The Omicron variant is upon us. The first person who was diagnosed happened to be in California. The individual who was tested positive, and I'm sure it's not the last person, it was fully vaccinated, but had not received their booster yet. And so it really does speak for the need for those of us who have been vaccinated longer than 6 months, or those with underlying conditions, or if you received the J&J vaccine, it's 2 months that you're eligible to get the booster. Get the booster. If you haven't been vaccinated, the variant is another example of why you absolutely need to, because this virus will continue to mutate and cause significant harm in our hospitals and in our communities and in our business community until we can get control of this. And again, you've heard me say this before, this is not a political discussion. This is a public health crisis. So we're really urging you to continue your dialogue with your physicians if you indeed haven't received a vaccine. If you have received the vaccine and just haven't gotten around to getting the booster, we have it available for you. And please look at the times. And obviously, we ask for appointments because we have had an increase in the numbers, mostly driven by children, thank goodness. And we're very excited about that because we know that kids need that protection and can often carry to older adults. And even if they've been vaccinated, can cause them to get the virus if they're immunocompromised. The data tells us if we do not make significant progress on getting people boosted, we will have a December and January like we had last year. The difference is we do not have enough staff to be able to care for them. You see this across the country. Every hospital is looking for staff. And so if you really want to give a holiday gift to someone you love who works in healthcare, get the vaccine, get the booster. That's my request. This week is National Influenza Week, so it's very helpful for us to bring attention and reminder of just how critical it is to just take that moment to get that flu shot. We really are being told by the experts that they are very concerned that we are going to see a significant increase in the volume of hospitalizations due to upper respiratory distress from flu and pneumonia, obviously. So please, please, please make sure you encourage your loved ones to get the flu vaccine as well as the COVID vaccine. So another example of this community's tremendous support is we received the very generous gift from Elaine Doherty of 300 hand-knitted caps. They are both adult and children, and so they went to our Leading Edge Cancer Center in Mullica Hill, as well as to our maternity unit to be able to take care of small caps for the babies. It's just another example of the generosity of our community. One of our nurse navigators, Barbie DiMatteo, in the oncology department, shared with us the thoughtfulness of people like Elaine Doherty is really shown on the smiles of the cancer patients, that to think that someone would take the time to give gifts to people they don't know. Her comment, which really struck me, was, we need more Elaine Dohertys in this world, and kindness does matter. And that's really the joy of the season and the reminder of how special it is to live in South Jersey around people who care and give so much to others. So until we meet again, be well and stay safe.